Hello, everyone. This is Dr. Jaitly, your cardiologist from New York, on MuniMeterHealth, which is our format where you have a source of learning for cardiology as well as for human heart awareness. So, thank you for associating on MuniMeterHealth. In this particular video, I particularly wanted to um, talk to you about what are the possible young athletes who actually can suffer cardiac serious issues, including life-threatening situations as well, on the fields or on the tracks. And specifically, we are talking about while they're playing American football and NFL, or maybe perhaps playing the basketball like in the NBA or even the NCAA, what have you. And then, of course, not to mention the least, but the fact is that the tracks, the swimming, the marathons, and of course boxing and skiing, these are all very, very competitive sports which really require a lot of physical activity, and you have to be in really top trained, conditioned, physical state to participate in these as team members, as team players. So, just quickly to understand what are the possible clinical clues that can occur. One, of course, if the young adult is having chest pain, which is unexplained, or breathing difficulty, or a syncope, for instance, any of these symptoms that occur, obviously should demand an immediate attention to your doctor. You have to, maybe at a school nurse level, it could be possibly be entertained. Palpitations, dizziness, and unusual fatigue. Remember, if you're getting tired much earlier than the rest of the team players, there's a reason why you're getting tired. Perhaps there's not enough oxygen going to these coronaries. Like I've shown the schematics here, this is the outside of the heart, for instance. Here the coronaries are supplying the heart, and as you know, the heart supplies the rest of the body. So these are coronaries, which are supplying the blood to the heart. So heart has its own supply, and one may have abnormal bridges, we call them, or abnormal myocardial bridges or myocardial tunneling, if you will. That means the coronaries have difficulty passing through the heart muscle, and they're actually embedded within the heart muscle. Same thing is true here. Well, there are situations where all of these conditions can lead to, say if somebody's have a heart murmur, for instance, or we should write heart murmur here. And a heart murmur could be a good clue to really bring the patient over for an echo, for instance, and one can find hypertrophic cardiomyopathy. Now, this is where the hypertrophic cardiomyopathy exists. There's a hypertrophy here of the septum, or you may have an ARVD, as we call it, an arrhythmogenic right ventricular dysplasia, where the right ventricle, this being the right ventricle, is more fibrous. It's not muscular, so that can lead to there's no blood going to oxygenation to the lungs. Remember, the right side is pumping blood into the lungs, and therefore no oxygen is really being derived into this blood here. So that when the blood returns back on the left side, it's not oxygenated. It may look, in fact, more bluer than the red. So there are so many conditions that we can talk about. The aortic stenosis, for instance. The aortic stenosis is right here in the aortic valve. This valve is too stenosed to send blood into the aorta. Mitral valve prolapse can actually generate some arrhythmias. Then we have EKG abnormalities like WPW, for instance, and long QT and Brugada, and all of these could be pointed out by a cardiologist. But the whole idea is wanting to see what can really be a suspect here, because certainly you want to have certain clinical clues that will lead you to go to a GP doctor. And when you go and see a GP doctor, after that you'll be able to see a cardiologist. And when you see a cardio MD, all these tests can be done, like an ECG, an echo, an MRI, a Holter, and a stress test, as well as an angiogram. Now, MRI and angiogram I actually reserve only for patients where there is some clue to suggest that there is a condition that can be treated, or you can't find anything and still you have very alarming symptoms like syncope, or where a person is passing out, or there is unusual shortness of breath during the time when the person is actually playing football or basketball. So again, blunt injuries are very important as well, because blunt injuries can hurt the aorta, can hurt the coronaries, and even the pericardium. You can develop a tamponade, we call it, a fluid collection around the heart, because the blood has leaked outside into a pericardial sac, and that compresses the heart. So numerous things that can occur, and once the injury occurs here, it could be a blunt injury. It doesn't have to be an open wound. And the child, the young adult, whoever is playing, I call them kids. These kids, when they're playing out in the fields, unfortunately, they suffer a lot of chest injuries. We know about the head injuries. We know about the spinal injuries already in the American football. It's a very, very fascinating sport, no question about that. But the fact is that we do have a potential for injuries, and these chest injuries can lead to blood within the pericardium, we call it, and sometimes a tear in the aorta can occur right here, and that could be devastating because an aortic root that dissects, that can, that immediately the person has to go to the surgery. It has to be recognized first and quickly go to the surgery. So there are numerous cardiac conditions that I just wanted to make sure that on the video I can quickly show you exactly. And there are, of course, clinical clues that will determine where to send to the doctor. There will be possible testings that we can do. We just talked about these testings here. And what are the possible conditions that can affect the young adult. And of course, the family history of sudden death is very, very important as well, because somebody in the family has died, etc. So all of that could be taken into account as well. So all of these clinical features and clues, they could be immediately brought to the attention of the general practitioner, either through a nurse from a school level, which I normally see as a possible source, or even a general practitioner can actually recommend to the cardiologist if he or she comes across, say, unusual symptoms in that young individual before clearing for a regular physical examination. Okay, thank you again for your attention. I appreciate your interest on MuniMeterHealth, your source for cardiology and patient human heart awareness, both in health as well as in illnesses. Thank you. So long. This is Dr. J.